Being overweight or obese during pregnancy can cause problems for you and your baby. Get to a healthy weight before you get pregnant. Talk to your provider about the right weight for you. Talk to your provider about how much weight to gain during pregnancy. Don't ever try to lose weight during pregnancy. How do you know if you're overweight or obese? Being overweight during pregnancy can cause complications for you and your baby. The more overweight you are, the more likely you are to have pregnancy complications. But there are things you can do before and during pregnancy to help you have a healthy baby. Being overweight is based on your pre-pregnancy body mass index, also called BMI. Pre-pregnancy means your BMI before you get pregnant. BMI is a calculation based on your height and weight. 1. If you're overweight, your BMI is 25.0 to 29.9 before pregnancy. Overweight means you have an excess body weight that comes from your muscles, bone, fat, and water. About 3 in 4 women, 75% in the United States, are overweight. 2. If you're obese, your BMI is 30.0 or higher before pregnancy. Obese means you have an excess amount of body fat. About 1 in 3 women, 36%, in the United States are obese. What kinds of pregnancy complications can being overweight or obese cause? Before pregnancy, if you're overweight or obese, you're more likely than women at a healthy weight to have problems getting pregnant, also called infertility. Obesity can affect a certain kind of fertility treatment called in vitro fertilization, also called IVF. IVF is when an egg and sperm are combined in a lab to create an embryo, fertilized egg, which is then put into your uterus. The higher your BMI, the less likely it is for you to get pregnant with IVF. If you're overweight or obese during pregnancy, you're more likely to have these complications. 1. High blood pressure, preeclampsia, and blood clotting problems. High blood pressure is when the force of blood against the walls of the blood vessels is too high. Preeclampsia is a condition that can happen after the 20th week of pregnancy or right after pregnancy. It's when a pregnant woman has high blood pressure and signs that some of her organs, like her kidneys and liver, may not be working properly. Clotting problems are when blood clots partly or completely block the flow of blood in a blood vessel. 2. Gestational diabetes. This is a kind of diabetes that some women get during pregnancy. Diabetes is when your body has too much sugar, called glucose, in the blood. Being pregnant past your due date and problems during labor and birth, including problems with anesthesia, pain medicine. You also may need to stay in the hospital longer after having your baby than women at a healthier weight. Cesarean birth, also called C-section. This is surgery in which your baby is born through a cut that your doctor makes in your belly and uterus, womb. If you're obese, you're more likely to have complications from a C-section, like an infection or losing too much blood. 3. Miscarriage or stillbirth. Miscarriage is when a baby dies in the womb before 20 weeks of pregnancy. Stillbirth is when a baby dies in the womb after 20 weeks of pregnancy. Trouble losing your pregnancy weight after giving birth. If you're obese, you're more likely to have other complications, including 1. Infections during pregnancy, like urinary tract infections. 2. A sleep disorder called obstructive sleep apnea. This is when your breathing stops while you're sleeping. 3. A dangerous blood clot problem called venous thromboembolism, also called VTE. This is when a blood clot breaks off and travels through your blood to organs like the brain, lungs, or heart. This can cause a stroke or heart attack. 4. Needing to go to the hospital earlier in labor, having longer labor, and needing to have your labor induced. Inducing labor is when your provider gives you medicine or breaks your water, amniotic sac or bag of waters to make your labor begin. 5. Problems with breastfeeding. Can being overweight or obese cause problems for your baby? Yes. If you're overweight or obese during pregnancy, your baby is more likely to have these conditions. 1. Premature birth. This is birth that happens before 37 completed weeks of pregnancy. This is too soon and can cause serious health problems for your baby. 2. Birth defects, including neural tube defects, also called NTDs. NTDs are birth defects of the brain and spine. A birth defect is a health condition that a baby has at birth. Birth defects change the shape or function of one or more parts of the body. They can cause problems in overall health, in how the body develops, or in how the body works. It may be hard for your healthcare provider to diagnose birth defects during pregnancy, even prenatal tests like ultrasound. 3. Macrosomia, also called large for gestational age or LGA. This means your baby weighs more than 9 pounds, 15 ounces, 4,500 grams at birth. When a baby is this large, it can cause complications during labor and birth, including injury to your baby. It also increases your chances of needing a C-section. Diabetes, heart disease and obesity later in life. What can you do to improve your chances of having a healthy pregnancy and a healthy baby? Before pregnancy, get a preconception checkup. This is a medical checkup you get before pregnancy. Your healthcare provider can help you find ways to eat healthily and be physically active to help you lose weight before you get pregnant. Losing weight before pregnancy is good for both you and your baby. If you're thinking about weight loss surgery, talk to your provider about your options and how long to wait after the surgery before you get pregnant. During pregnancy, do these things to help keep you and your baby healthy. 1. Get early and regular prenatal care. Prenatal care is the medical care you get during pregnancy. Go to every prenatal care checkup, even if you're feeling fine. Your provider gives you prenatal tests, like a glucose screening test for diabetes and ultrasound to get a picture of your baby in the womb. 2. Talk to your provider about how much weight to gain during pregnancy. If you're overweight, you want to gain about 15 to 25 pounds during pregnancy. If you're obese, your target range is 11 to 20 pounds. 3. Eat healthy foods. Talk to your provider or a nutritionist to help you plan your meals. Check out choosemyplate.gov from the U.S. Department of Agriculture. It can help you make a healthy eating plan based on your age, weight, height and physical activity. It also has a special section just for pregnant women. 4. Don't diet. Some diets can reduce the nutrients your baby needs to grow and develop. Don't try to stay at the same weight or lose weight during pregnancy. 5. Do something active every day. Talk to your provider about activities that are safe for you. Hope this helps. Wish you all a happy pregnancy.